So just a little level setting. In 2024, we started the community safety forums really so that we could get feedback and focused feedback and understanding on how people felt about public safety and their concerns in the Seattle area. We have continued with this focus again for these safety forums because last year's feedback really helped us create the One Seattle Restoration Framework, which has 6 near and long-term strategies for us as a city to implement for you all through the department. This year, our forum is an opportunity for us to share with you all how all the city departments work to support the framework within your specific communities. And at the same time, it's really an opportunity for everyone here and the community at large to meet Chief Barnes, Chief Scoggins, and Chief Amy Barden to hear their holistic vision for public safety together and have table discussions and talk and collaborate to find solutions together. Like I mentioned, I'm on the Mayor's Office Public Safety team, and what I want to say is we know that public safety means a lot of things to a lot of different people, and so it's our job to work in collaboration with all the different departments to focus on what safety means for you and community. So when you see that there are tables that talk about youth violence prevention, when you talk about SDOT traffic safety, when we talk about beautification, and neighborhood park safety, we all know that works together and intertwined with all of these departments' work and how the city responds to what makes a space safe for you all. So, I am going to start with some ground rules for today's forum. As you can see, we're set up in small tables, so it's a little bit different from what you might know as a public safety forum. We're not going to have like large question and answer sessions. We're gonna have more close, interconnected conversations so you can have a good discussion between your table group. So, the very first thing for ground rules is be respectful of others. When you're talking with each other at the different tables, be respectful and appreciate that there's diverse opinions and experiences. Be an active listener. So, even if it's not your turn to talk in your conversation, and even if you may disagree, please let the person who's speaking finish their thought. And then I would say, this is like we're at a movie, but please set your phones to silent. We don't want to be disrupted at this point because even when I was just yelling at the beginning of this, it's really hard to hear. So when we start having our separate discussions in these table groups, the noise is going to travel. So any extra noises is going to make it really difficult for us to have a productive discussion. So the next slide is the One Seattle Restoration Framework that I mentioned. This really was really helpful for our last year's forums to really come up with this. And with the One Seattle Restoration Framework, we have reducing gun violence, prevention and a reduction of high impact crime, responding to 911 calls efficiently and appropriately, confronting the opioid crisis with a public health and safety approach, activating and enhancing neighborhoods, tackling the root causes and impacts of violence. Those are what these tables are based on today. So just because you're sitting at a table right now doesn't mean you're committed to be there for the discussion. Just know that this restoration framework is how we set up these table discussions. So depending on what you're most interested in discussing tonight, please feel free to join that table discussion. And now I have the pleasure of introducing you to your city council member, Councilmember Saka.
Thank you so much. Good evening everyone. Good evening. My name is Rob Saka. I am your Seattle City Council member for District 1, and it is an absolute honor and pleasure to serve you. Welcome. We're all here tonight because we all care about community and public safety in District 1. That public safety is actually the number one query or concern or question or piece of feedback that my office hears regularly from my constituents, you all, our neighbors across West Seattle, Pioneer Square, Soto, Georgetown, and South Park. It's the number one issue we hear. And that's why I'm glad to be here today, because we have the three chiefs. I want to thank the mayor's office for organizing and hosting this event, and their partnership on addressing any number of these issues and their related solutions. Public safety is the number one issue here, continues to be. And as your legislator in City Hall, I take my responsibility seriously to write laws, write investments through the budget process and appropriations process, and also, most importantly, advocate on your behalf directly to the three chiefs here, the respective teams, to help us do more. I want to say a special thanks to my own team, Elaine, Eric, Ian, if you wouldn't mind raising your hands. They are some of the city staff, the many city staffers here today and here to serve you. We are all committed to doing better as a city. And that's why I'm glad that we're organizing and hosting this forum, because we intend to listen, learn, and act. So, without further ado, we're going to get on with the program. Thank you all for being here, and it's really good to see some friendly faces in the room as well. Some neighbors, community members, community leaders. I saw the Elkhart Community Council represented here, Charlotte. Saw the owners of the arcades, Matt and Alyssa. Matt, I know Matt. But it's so good to see so many familiar faces here. We all care. So let's get going, do the work. Thank you.
Thank you so much, Councilmember Saka, and thank you for everyone for paying close attention. The way that we're going to proceed with this forum is we're going to have all three chiefs do a brief presentation, and then we'll break out into our table discussions. So I get to pass it off to Chief Barnes now. Thank you.
All right. Good evening, everyone. Good evening. It is my pleasure to be here with you. My presentation has been getting shorter and shorter and shorter. They're telling me to stay on time, and I'm probably not going to do that because I'm so passionate about this topic of public safety and how do we return Seattle to the Seattle we all want, the Seattle we all know and love. We spent in my first 6 months not just time getting to know the community. So there's faces in here that I've seen before and I've seen out, and I really like that. But more importantly, we got to work detailing what is it that the department does well, what does we do well as a city, what support systems do we have, and how can we put together not just a plan, but a commitment to public safety and ensuring we have a safer Seattle. We call it Seattle-centric policing. This plan was reviewed not only by staff, but presented to the mayor's office, the exec team, and we presented this, you heard the term, evidence-based policing, to several scholars throughout the country that are familiar with police work, and they're telling us we're on the right path. And so today, or tonight, I'm just going to give you a brief overview because I want to leave some time, of course, for the other chiefs, and of course, some time for us to talk. I'll be floating around to try to answer some of your questions. So we'll go ahead and get started with Seattle-centric policing. And essentially, this is what Seattle-centric policing is. It is a commitment to integrated partnerships. What we know about public safety is that the police cannot reduce crime alone. It takes partnerships with other people. There will be times when the police will lead, and there will be times when other people will lead, depending on the problem. And so we have divided our problems into different precincts. We have priority areas, we have priority addresses, locations, and yes, we do have priority offenders. There are certain groups that are responsible for an enormous amount of crime. We have to give them our love and attention as well. We have to set them on the right path if we can, and if not, we have to hold them accountable for their actions. It is a community-centered approach, and so this is not a one-off for me. This is not, you'll see me and then, 2 years, 3 years later, you'll see me at another time. No, this is something that is ongoing. So any document, any plan that you do, it has to be consistently evaluated and assessed. So you will see me again and again and again. If not, you'll see the command staff, the command team. It is crime and harm focused because there are certain things that are contributing to the level of whether or not you feel safe that may not rise to a level of crime. And we see those things as police departments, and because we identify those, it is our responsibility to find the right partner to address what those issues are. Whether it's homelessness, whether it's public drug use, whether it's someone that's suffering from a mental health episode, we may see it first. And so we want to make sure that we can call the right people to solve that problem. It's city supported and service oriented. I don't want to gloss over the fact that it's city supported because right now our city, in my judgment, is working together. I've been in 2 other police agencies in 2 different states. And usually the biggest problem I have is bringing people together, even people who work under the same city umbrella. I don't have that problem. The public safety team here has committed to working and giving us what we need. The city council has committed to working and giving me what we need. I meet with Councilmember Saka regularly and the rest of the council members to talk about how can we better serve our community. That's not normal, believe it or not, in policing. In some places, I have to try to develop those relationships, but I don't have to do that here, so we're headed in the right direction. And service-oriented. We have to work a little bit harder establishing relationships with people who provide services. And it's okay to provide services for people, but what happens once they get that product or that thing that you're doing? We have to make sure that everyone is being held accountable for the things that they're going to do. There's going to be times in this plan where we're going to reach out to nonprofits, we're going to reach out to the faith community, we're going to reach out to anyone who wants to help, and those people who are already helping, we want to make sure that we can improve the way the services that they're providing. A little bit into the how and what we have going on operationally. I'll go over this really quickly. The main thing is communication. Communication can only go up, can only be improved. And so you will notice with our police department, the way we communicate is changing just a little bit. We're showing some of the positive stories that we're doing. We're showing some of the days where we don't see things that go wrong. And when things do go wrong, we're being transparent about it and we're letting you know. I've always had this philosophy that people can only participate in their own public safety when we're transparent about the things that are going on. The precinct community meetings are still going on. We're working on a community concern portal. I know some of you have concerns, and I've been out and about at 2 in the morning, 1 in the morning, 10 at night, when the parks and beaches are closed. I've witnessed those myself. So I know that your concerns are valid because I've been there myself. I'm not just going to listen, I'm actually going to be boots on the ground, and I'm very interactive with what's going on in all of my precincts. We're working with our relational policing unit. We have a couple of representatives here, as well as our advisory council. And I'm very excited about this last point, is that right now we're piloting what I have always done in my career, which is neighborhood oriented. You should know the police officers who are assigned to your neighborhood. And so we have a neighborhood in the city that I don't want to name, even though it was named accidentally today, where we have 2 officers who are working an entire shift in that particular community. They're doing foot patrol, they're doing bike patrol, they're meeting with neighbors, they're answering calls for service, and we're going to measure whether or not people notice, whether or not we can have a reduction of crime, whether or not the officers have a greater satisfaction at work, which we believe that they do, and we're going to measure what we need to be successful. I would like to move this to many other neighborhoods. And so I met with the precinct commanders. We have some neighborhoods identified, and if we can show some efficacy. We can show that this is what works. And if our community says, I want a neighborhood officer, I want to work to make sure that happens. We have done a lot of reorganizing in our police department. We're going to continue to do that. I think that's an ongoing challenge that we have. We're supporting crime and harm reduction. We have this picture over here is from our CSAT. So what happens in CSAT is that we get together and the precinct captains present on problems that the community has brought forth, and then we problem solve how we can fix those problems and how are we measuring what is actually happening there. Think of it like going to the doctor and asking, you saying you have a problem. The doctor will not only give you a treatment for it, but more importantly, he or she or they gives you the dosage. And that's what we do in that meeting. We determine, do we have the right dosage? Have we had enough man hours on this problem? Too much and it feels overbearing. Sometimes people use the term over-policing. Too little and it feels like you're being ignored. And so not only are we trying to prescribe, if you will, in this meeting, the right strategy for loud noise, the right strategy for car takeovers, the right strategy for people doing burnouts and donuts in the middle of the parking lot, but also how much interaction with police do we need in order to reduce that. So I'm very pleased with that. We made one hire. We have an executive director of crime and harm reduction, which is an embedded criminologist, Dr. Hunt. You mind raising your hand for me? That's Dr. Hunt. He comes to us with over 30 years of experience in the field of crime and harm reduction. And most police departments don't have someone like that. They kind of figure things out, but we're working on a more science-based approach to make sure that we can address all the things that you want. You've heard us talk a little bit about crime prevention through environmental design. You probably heard us talk about trimming back trees. We have one area in this particular precinct. We have one area in this particular precinct where people like to go and they like to test fire weapons. Why would they want to do that? Well, it's dark, people can't see, it's overrun with bushes, at least it was. We worked on it. And the good news is, when we do things like that, we reduce the opportunity for people to do that. And there may not be an intended target for that particular area, but when you hear a gunshot, it does not contribute to your fear of crime, right? It makes you more fearful. No one, by the way, to be clear on this, no one should have to put up with that. I don't care where you are, whether you are in this precinct or in New York or wherever, no one should have to deal with that in America. The Real-Time Crime Center, you've probably seen some things about that. We're having some success. Dr. Hunt can talk to you a little later on if you're considering or if you're interested in that. Want to know about the expansion, where will public space cameras be in your precinct and when you can get them there. We're going to move up a little quickly. Recruitment and retention, we're doing well. We're on path, and we may have already passed that, to hire more people, more cops this year than we ever had in the history of the police department. Last year, we hired 24 police officers. This year, we've already hired 107. And so we're certainly going in the right direction. Thank you. And that is because of the encouragement and generosity from everyone in this room, right? I take no credit in that. That was already on the way when I got here, because your leaders and your mayor and your community said, we want to restore our police department because we want to be safe and feel safe. So on behalf of the police department, thank you. These are our significant incident categories. We can talk about those a little later. I'm going to move up a little bit. These are some of our numbers. We are seeing reductions in violent crime, reductions in property crime, 21% reduction in the shots fired, and a 29% reduction in homicides, which I think that number is actually 21 now, just to be specific. But we are, facts matter, we are seeing some reductions, but there's still a lot of work to do. If anyone tells you that I take victory laps, they don't know me very well. I am always pushing for two things: a sense of urgency and a sense of collaboration. All the commanders know it. They know if you see those two things, you make me happy, right? Because this is good, but we can do better. And as we get more police officers, as we get more community cooperation, we'll see these numbers continue to go in the right direction. While things are going in the right direction, just let me say this. This is the time to come together, right? This is the time to come together and say, we want to stay the course because things are going in the right direction, but what could it be if we all chip in just a little bit more? If we all believe in each other just a little bit more? If we all hold each other accountable just a little bit more? And that's what we need from each and every one of you. We talked about business and government. Our legislative body has done a lot to help me out passing nuisance abatement recently, and I've used that already to address some of the problem locations, because when people have businesses, they have to be responsible business owners if they're having nightlife and entertainment and things of that nature. This is just some examples of some of the hard work that they've done in 2024, and we're certainly using some of that, I think, to help us out. Talked about community already. Community to me is the individuals that are in this room, your families, your neighborhoods, which I think is important. Our business community, if you are here from the business community, just so I want you to know that I appreciate you, I thank you, I respect you. Earlier today, you may have heard, we had a robbery of a local business, and I was there. I spoke with the owners, and it just kind of filled my heart, really, to be able to be in that space and just offer a little bit of reassurance to them, but just to know how hard business owners work. My father, as some of you probably heard this before, was a small business owner, nothing like, some of the great businesses that we have in the city, but he provided a service to folks and had a couple of tow trucks and things of that nature. But I say that to say I do have a big heart for our business community, so if you are in here, I want to meet you before you go. Our educational institutions as well. Trust is what it's all about, right? So you will hear from me throughout the course of my tenure. You'll hear from me when things are going well. You'll hear from me when things are not going well. And you will hear from me when we miss the mark. Because that is how you build trust. Just lastly, before I turn over for a couple of questions, this is not just a plan. This is just a brief overview of it, but this is a commitment. Meaning these are the things that we're telling you we're going to do. And in everything that we do to keep you safe, you should see crime prevention, you should see services and support, and you should see the community and our government working together to solve that problem. Maybe at different levels, depending on the complexity of the problem, but that's what you should see. And I think if we do that, we're on the right track to making you feel safe and making sure that you are safe. And that's my commitment. Thank you.
Thank you so much, Chief. And as he mentioned, we are going to take a few questions from the community. So the first question is, how can the Seattle Police Department improve enforcement of parking rules to prevent abandoned vehicles in streets, neighborhoods, and homes, while going beyond the restrictions of the current 72-hour parking regulation?
So the first thing is we do have parking enforcement officers. The precinct captains and commanders are empowered to deploy them as they see fit. And so what we're setting up now in the department is they have the ability to call them in and let them know when and where they need them for. Obviously, there's more territory than it is parking enforcement officers, so we need you to help us to be our eyes and our ears. When I talked about the community concern portal, that's part of the strategy. We already have something similar to that. How many of you are familiar with Find It, Fix It? Yep, so you're familiar with that. So we want to be able to attach to Find It, Fix It things that we need to address. And so you can go on the app to Find It, Fix It, and hopefully we'll have a spot there soon where you can say, well, this RV has been here for 3 weeks. I know that's not possible, but if that is the case or was the case, then you can let us know and we can send someone out there immediately to deal with it. The idea is we need quicker response, I think. We need a more coordinated response. And then, it's the most important part. What was that word I told you is so important? Communication, right? We want to be able to report back to you when we found out about the problem, what we did about the problem, and whether or not it was resolved, even if it wasn't. That is very important to me. I think closing that feedback loop is important not only for trust building, but also for problem solving.
Thank you. The second question, with the shift of reporting many crimes online, what measures are in place to ensure proper follow-up and investigation so residents feel their concerns are addressed and justice is served?
So this one is kind of complicated because with the online reporting portal, there is a section that states that that's not for follow-up. So we direct people to the online reporting portal when you don't have leads or suspects or anything to follow up on. So usually people use that when they need reports for insurance purposes or whatever it may be. If you have a incident and you need follow-up, you need to try to get in contact with a police officer or call the telephone reporting unit if you think that is the case. But if you were to do that report and you discover new information, then we could use that case number to open up a case and assign it to one of our general detectives. But you can't follow up on things without leads. But I will say this, and Dr. Hunt was probably one of the first persons to kind of bring this to my attention many, many years ago, and we worked on this, and I see him smiling because you know what I'm about to say. He kind of likes the online stuff, but not really, because there's no procedural justice in it. And what I mean by procedural justice is you need to know what's going to happen. You need to know or be reassured that we understand the problem. And a simple follow-up call, a simple email back with, hey, did you find the serial number, or do you have any additional information? Dr. Hunt always reminds me to go a long ways. So we're not against the online portal, but what we're saying is if we could make some tweaks to it, it would be adding some procedural justice, or let me use a better word, it would be improving the customer service experience. Does that make sense to everyone? And so we're going to work to do that, because that's one of the things that he's been on the forefront for a long time. Nothing against it, but the customer service experience means a lot to me.
Thank you so much, Chief, and another round of applause for our Chief. So I have the pleasure of calling your Fire Chief Scoggins up here to be the next presenter. One of the things that I do want to mention is we are so lucky to have your legislative representative, Representative Thomas, here today. Oh, there she is in the back. I'm going to let her say a few words after the other two chiefs do a presentation. But we are so happy, and we're happy that she's here attending this forum so she can also hear from her community. The other announcement I want to make is the public safety team is here staffing along with all of your city department staff here. But if you have any questions during the presentation or after the presentation, look for the people with the black staff shirts and the seal of the city of Seattle. So without a further ado, I'm going to send it over to Chief Scoggins.
Thank you. How's everyone doing tonight? You all right? A long day, but we made it. We're here. That's important. And with us, showing up is a big deal. You know, everything that we do, we got to show up. That's really important. But it's also important for you to know that we don't do it alone. Generally, we come with the team and we bring a lot of folks with us, even on nights like tonight. So I'd like to introduce a few of our folks who are here with us tonight. who really make the SFD go forward. Starting off with our Assistant Chief of Operations, Assistant Chief Brian Hastings, sitting over here to my left. Raise your hand or stand up or something. Let them know who you are. There you go. Chief Hastings has a big job. We have 33 fire stations in the city of Seattle. All those rigs that go in and out the doors every single day out of all of our stations, that's his responsibility. Making sure those firefighters are well trained and ready to go whenever they head out to serve all of you. That's important. We have Deputy Chief Jack Herman here with us tonight, sitting over here at our table. And Jack is our Deputy Fire Marshal. So things that are built and come out of the ground and making sure those who live and work here in Seattle have a safe place to be, that's a big part of his responsibility. And we have Carrie Brazil over here with our Public Affairs Division. Carrie's out in the community with the team, educating the community and really working hard to make sure folks are safe. And one of the folks in the back of the room I'll introduce, because he's going to be at one of the tables, is Lieutenant Roger Weber. Lieutenant, would you put your hand up right there? Now, Lieutenant Weber, he's a special individual. When we stood up our mobile integrated health team in 2019, he was one of the first folks who went out and rode on that team and served folks on Health One. And I'll talk about that team a little bit more, but Lieutenant Weber does an amazing job. So we anchor in our mission, vision, and values. That's important for us. Saving lives, protecting property, and the environment. That's a big deal because you call upon us between 300 and 325 times a day, all over the city, to do just that. Go out the door with lights and sirens to solve a problem. It could be a cardiac event, it could be a fire, it could be a rescue, it could be whatever. So saving lives and protecting property and the environment, that's really what we're anchored in. And that's built on trust, because we couldn't do that without you trusting us to come into your homes, to come into your place of business, without question. We go into homes at 2 in the morning, and sometimes folks are in their worst way, and you trust us to take care of you, and then to lock the doors, cut the lights out, and sometimes wash the dishes or fix a handrail if it's needed in a home. We didn't make that happen. All those firefighters that came before us made that happen. It's our job to carry that on into the future. And then our vision. You know, the Seattle Fire Department, part of our vision is being a national leader and doing excellence in all that we do. So a national leader. Most folks will think about our Medic One program that's been around for over 50 years now. It's recognized worldwide. We have folks visiting us all year long to learn how we do paramedicine in Seattle. We have the highest cardiac save rate in the country, so you have a higher probability of being saved from a cardiac event here in Seattle than you do anywhere else in the nation. And one thing I always say with that, if you faint, you have a high probability of someone doing CPR on you, because we have more folks trained here in Seattle than anywhere else. And we take pride in that, in training people in CPR. But our vision, the national leader, when I talked about our Health One program, when we started that program in 2019, we were one of the first folks in the nation to do it. And as that program has evolved, we have a few other firsts. We started giving buprenorphine with our Health 99 program in February of 2024. February of 2024. Our paramedics started giving it. We were the first paramedics in the state to actually give buprenorphine. When our EMTs started to do it in November of 2024, we were the first EMTs in the nation to give buprenorphine to someone who has had an overdose. So our vision is very important for us, being a national leader. We're really trying to innovate all the time. And we're anchored in our values at the bottom of the screen. But integrity leads our values, and that's where we build our trust with all of you. That's really important. Our organization is broken up into really 4 lines of business. We have operations that Chief Hastings leads, all those folks going out the door every day. We have our fire marshal's office, and everything that's built in Seattle, we look at it, whether it's through plan review, engineering, inspection, new construction inspection, or even enforcement. That's important for us. And generally, once the building is built, In the city, the fire department is the only entity in the city that touches that building consistently to make sure that we have fire and life safety. So you see our firefighters come in and they want to do an inspection. Sometimes it's convenient, sometimes it's not. But our goal is simple. We're just trying to make sure the buildings are safe, whether it's a business, apartment building, and things like that. And then we have resource management. That's where our fire alarm center lives, our emergency preparedness, where all of our training lives, to train all these new firefighters. And just to give you perspective, in February of 2025, we hired a class of 41, 25 graduated, and on Wednesday of this week, just yesterday, we started our second class of the year with 62. So now they have their 15-and-a-half-week journey. All that lives under resource management. And then we have the business line, our executive director of administration with our finance, HR, our public affairs, and our IT liaisons. So that's a little bit about the SFD. But we really anchor in three things: prevention, education, and mitigation. So if you're going to sum up the work that the Seattle Fire Department does, you could just sum it up in those three words: prevention. Everything that's built in the city, everything that we touch, all the plans that we review, all the engineering, all the new construction inspections, the fires happen, we're coming in to try to figure it out so we can prevent the next one from happening. All that is anchored in prevention. And we have a great team that works in that space. And then education. We're out in the community, Carrie and her team, we're doing public education like you wouldn't believe all over the community, teaching CPR, we're in the schools, teaching CPR, we're in the senior living facilities. Education is what we do, because an ounce of prevention is worth a pound of cure. I heard, all right, thank you, Sheep, appreciate the support. So that's education, we really work hard. But mitigation, what you expect from us is when we get there, that we're prepared. We're ready to go. If it's a cardiac event, if it's a structure fire, whatever it is, you expect us to be ready to go on whatever the problem is. And we get called to a lot of different fires, whether it's a boat fire on South Lake Union, whether it's a vehicle collision on Interstate 5, whether it's a structure fire, a cardiac event, a stroke, doesn't matter. When you call us and you expect us to show up, you expect us to be ready to go. And we are. We commit a lot of time to being prepared with how we train. We train for every scenario that you could possibly think of. The equipment that we have, we're fortunate to have the mayor and the council to support us consistently in getting us the best equipment that we need. And that's really important for us. And what we're seeing as the city grows is we're seeing a rise in our call load. At the bottom of the screen there, you see 112,000 responses in 2024. That's the most that we have had in our history. And we have been seeing a steady increase in calls here in the city of Seattle. We brought a few charts with us tonight, and one of them is a map of the city and all the different battalions. We have one separated by council districts and one separated by our battalions, so you can see which stations are closest to you. But we also have the rising call load, so you can actually see the perspective on the growth. And we expect more of that. As we build more buildings, add more people, we expect the calls to continue to go up. And then the third chart to my left, probably your right, maybe your left, with all the bar lines right there, those are our busiest locations in the city. That's where we're going the most in the city. We encourage you to take a look at that as the night goes on. If I close, is it? Speaker. Oh, it's a speaker? Oh, the light went out. We got some help coming. What's that? Hand it to the chief, he'll fix it. Okay, here we go. I think it's close. I want to leave you with just a little information so you can stay dialed into the Seattle Fire Department. Every month, we push out a community-based newsletter. If you go to seattle.gov/fire, and you click on Responder, it's called the SFD Responder. If you sign up for that newsletter, every month you will get that newsletter and you will be dialed into what's going on in the Seattle Fire Department. And also, if you're curious about incidents around the community, you can go to the Fireline blog. Every time we have a significant incident in the city of Seattle, we push out information on that link. Because our goal is to keep you informed. We get a lot of those questions. But our goal is to serve you. You know, our simple motto in the Seattle Fire Department, is here to serve. No matter what the call, whatever time you call, we're here to serve. So I'll end it right there and see if there's some questions.
Thank you so much, Chief Scoggins. And so we also have 2 questions from the community for you. The first is, how is the fire department working to improve fire safety awareness and preparedness in communities, including hosting workshops or distributing educational materials?
Thank you.
Oh, he came prepared.
And because that was a long question, and I got it ahead of time, and I wanted to make sure I answered the question, I asked our team to put together some information, because that's a really important question. You know, we conduct several fire safety programs for adults and children, such as firefighter story time. And you know, I gotta tell you, that's the best part of my day. I get to go out and read story time to the kids too. And Carrie will tell you, I can read a pretty good story, right? I have a lot of fun, and it kind of gives me a little dopamine in my system when I'm reading stories to the kids. Let's see, we also have had public safety fairs at Fire Station 26 and 37 recently. We've attended health fairs in New Holly, High Point, South Park, where our community fire safety advocates teach general fire safety. And what our community fire safety advocates are is we have a group of folks, they are civilians, they speak multiple languages, we train them up in fire talk and education, and that helps us bridge the gap in the community. So whatever community we're going in, we want to make sure that we can connect. So we take the right community fire safety advocates with us. We also participate in senior apartment safety outreach with the Seattle Housing Authorities. There's a lot of those buildings. We have a lot of fire alarms at those buildings, so we're in those buildings a lot. We're working hard to consistently educate. And then we're in a lot of places. Let's see, senior condo housing on 47th Avenue Southwest. July 28th, we're going to be at Seattle Housing Authority in California. And then we're going to be at an SHA facility on the 27th. So all summer long and all year long, we hit a lot of spots all over the community. And our public affairs team is great. You know, every quarter they submit a list of key performance measurements to me and all the places that they've touched all over the city. That's really important for us to make sure that we're outward facing and we're getting out and serving the community.
Thank you. And the second question is, what steps are being taken to increase the number of fire stations or staff in West Seattle to address the growing population and ensure sufficient emergency coverage?
Absolutely. And it's bigger than just West Seattle, so I'll talk about what steps we're taking in West Seattle. Thank all of you for all of your support. Many of you probably know we added a secondary ladder truck in West Seattle, ladder 13 at Station 37 just a few years ago. That's been big for the city because before we only had one ladder truck in West Seattle, so that gives us more coverage there. We also added an additional medic unit at Station 26 in South Park. So those are resources that have been added to support this district. But the big picture is, what are we doing all over the city? You know, a couple of years ago, probably 3 years ago, to try to help with citywide responses, our goal is to keep units available to go on calls and get them out the door. And the calls that we can send somewhere else, we try to do that. So in February of 22, we added a nurse line to our 911 dispatch center, the fire alarm center. So if someone calls 911 and our dispatchers have protocols that they go through, and if it's a lower level medical emergency, we will send that call to the nurse line. And that's very important because the nurse can stay on the phone with them for 45 minutes, 30 minutes. They can give them guidance on self-care. They can help get them an appointment at an urgent care or a clinic because it's not necessarily in need of a lights and sirens response. Last time we went out the door, we sent 7,000 calls to the nurse line. That's really important when you think about the 112,000 call number. That would be 7,000 additional calls. And what we've also done with our mobile integrated health team, our Health One team, is by the end of the year we'll have a team of 10 case managers and a nurse practitioner. So what our firefighters do all over the city at those fire stations is they may go on the call, and it may be a person who calls quite often, what they will do is submit a form in our system, and then our case managers and maybe our nurse practitioner, they will actually go and do a house call and say, hey, what can we help you with? Our nurse practitioner has the ability to give drugs, call in prescriptions, get connected with their physician's family. Maybe they need food. Maybe there's a handrail that needs to be installed because they're falling a lot. Last year, we took out close to 4,000 calls out of our system for that. Now, that's the citywide system. So the 7,000, close to 4,000 calls would have been in our 911 system if we did not pull them out with those additional resources. We're always looking for new and different ways to get people to where they need to be. So, hope that answers the question.
Thank you.
Thank you so much, Chief Scoggins. And so who are not a city staff here knew that you have a care department? This should be everybody raising your hand. Who knew you had a care department? Okay, good. I'm sure that you do, and I'm so lucky here to say to you that the City of Seattle is so blessed to have a care department, and here is your Chief of the Care Department, Amy Barden.
It is good to be back. I did so many meetings in West Seattle, so many public safety walks, and right from the jump I said, anybody who wants to talk to me can talk to me in this city. I am a public servant, and you all took me up on it. There's a reason I know most of you, so I want you to know that is still true. You don't have to file a PDR request or anything like that. You can ask me a question. If there's a 911 response that you think is slow or ineffective, just ask me. We pull calls every single day, we'll QA it, find out what happened, and it really helps us to improve. All right. I did this last time, and I always go back to fire. Okay, so again, the department is supposed to have 3 divisions. The largest is Seattle 911. That's about 150 call takers and dispatchers. We want them elevated in the system. They're the first responders, and they should be invested in and supported. They need mental health supports just like any other first responders. The idea with the vision of the department is to center the data, to be able to rapidly iterate and look at the calls coming in and then recommend who would be the best first responder to this call. And so what Chief Scoggins just talked about is so significant. Ideally, we want the calls to go down. We want to break these cycles of crime and crisis, and we need to think of crime and crisis in the same terms. So that second division currently is about 30 care responders and supervisors. Thank you. Councilmember Saka is here and has been a great champion of that team. We met before he was in office, and his support has been sincere, and I really appreciate it. And then the third division by the ordinance describes organizing and coordinating community violence interruption work, survivor support, questions like that, so that we could just be more simple and organized. This was the Venn diagram most of you have seen. Tracy, it's great to see you. Tracy Record did some of the best coverage, actually, of the department, and I think really educated. Yes, we should clap for Tracy, I agree. Yeah. Such a wonderful teacher, and she spent a lot of time in dispatch actually understanding what I was talking about, went on ride-alongs. But the simple idea is just to build out that continuum, that we know we need law enforcement for some calls, we need police co-response for some calls. That's a care type worker with a ballistic vest, right? We think the situation could escalate. All those low acuity calls in the middle, they're social work in nature. We don't think they're emergent. Those should be a care response. We shouldn't be policing social issues. And then we know that we need Health One desperately. Roger Weber, it's really good to see you. He was one of the first ride-alongs I went on in Health One and taught me a lot about the nature of these calls and why that unit needs to be invested in. Health 99 also. So this is the ordinance that I'm describing. You can look it up. It's about 4 pages. And I think that people have forgotten what the council was trying to do back in 2020 and 2021. And so I encourage everyone to continue to advocate. It is really important that the care department is co-equal and supported in meaningful ways. It's one thing to talk about it, it's another thing to fund it, right? So the 911 center, again, we field about 900,000 calls a year, it's about 2,500 calls a day. About half don't really require one of the existing first responder units. We continue to compel police to go to a lot of calls that they don't think they're best served to go to, but that's the way the policy is designed currently. And again, I've only got care responders out 10 hours a day, 7 days a week, so that's wholly inadequate. Year to date, this was in June, the first of these I did, we had been to 416,000 calls. Our response time is fast now. We're staffed up. So I know people are always worried about 911 staffing. We actually only have 3 vacancies. I cut our attrition in half year one. We focused a lot on investing in people, on naming the specific trauma that they experience. And it was great that the city took interest. The mayor came out a bunch of times to visit, the press has been out. Suddenly, this really invisible, important part of the system became spotlighted and daylighted. So I really appreciate that. Priority 1 right now, our time to dispatch, meaning if we think somebody could be deceased in 5 minutes, that's priority 1, it's urgent threat to life. We are going to get that call currently assigned in 45 seconds, meaning we found a unit and they're on their way. On average, if it's SPD, they're getting there in about 11 minutes still. And so we want that much faster. We want that, again, if I think I've got 5 minutes, you would want the officers there in 5 minutes. Chief Barnes and his team are working really hard on staffing. It's taking a long time to recover from the attrition. Priority 2, again, the way I think about it is we need someone there in 15 minutes. You know, this is still an emergency, it could get worse. And that response time right now is about 22 minutes, which is much better. Priority 3, those are the types of calls that care can go to. Currently, it's taking SPD about 80 minutes to get there, and many times it's 3 or 4 hours because they've got priority 1s and 2s coming in, so we need to get after that. And then just a couple quick updates. One cool thing is until 911 was independent, we had never really participated in the 911 community. We weren't part of the membership organizations. We didn't talk to the other 911 call centers. We were actually at the national conference and people were like, oh my God, Seattle's here. Because just like police chiefs have, there's a really important network working on advancements in 911 and we just never participated. So it was really meaningful last year. We actually won Team of the Year for Washington State for a specific response to a call. And it's been really cool to watch folks learn from they're called PSAPs, learn from other call centers and implement improvements based on that. The crisis responders currently, I have one of my very favorite responders here, one of the original 6, who also doesn't love being in the spotlight. So just find the person wearing the blue polo and say thank you. But the team was originally 6 and now they've expanded to 24. I describe this all the time, they go a person down and welfare check calls and all that really means is we're worried about someone. We don't know what's going on here, somebody should check on them. And so if you're calling 911 and you're trying to invoke a care response, if it's available, you want to use those types of words. You want to say something like, I just need a welfare check. This person doesn't appear to be violent. There's no public safety concern, but someone needs to come. And so what we're actively working on now is getting, again, per the ordinance, the LEAD, those diversion contracts. Co-lead is emergency housing stabilization, outreach contracts. There's a lot of teams in Seattle that are really an extension of first response that we work with organically, but it's going to be much better when it's co-located with care. Because ideally, whatever the first responder unit is, we should be triaging and then handing off to a system that is appropriate. And so I'm always quick to remind people that we want the best first responders, we want to invest in first response, but we need that whole continuum. We need a correction system that is actually corrective, right? I think most people know that you're not generally getting healed or helped in jails or prisons. There are some bright spots, but generally it's just not designed that way. It's not designed to actually address what's going on in somebody's life. And then we need that behavioral health system built out. The crisis care centers are starting to come online now. We have a lot more capacity than we did when I started a couple of years ago, but we need to use it. And so with that, I'm going to take a couple questions. I'm going to take them from the audience.
Thank you so much, Chief Barden. Like you said, we do have a few questions from the community for you. The first is, how is the care department engaging with West Seattle residents to better understand the unique challenges they face in accessing essential social services?
Yeah, the main way is just showing up. So it's not just the care responders who are here based in West Seattle, but all of us in leadership. We're studying the crisis hotspots in particular. We know the nonprofit community really, really well. We know basically anybody who's in that service provision, and we're trying to understand what capacity do we have? Who do you best serve? And it's really important to know. I mean, I've been here several times, this place. Okay, who's at this community center? What are the services offered? So that we can start to stitch together the continuum. I think most of you know I'm not from government work, clearly, from the public sector. And I thought it was really funny how prescriptive we are. This assumption that if I don't have a formal contract with Mary's Place, I can't refer to Mary's Place. That's not how it works. You know, I'm from that sector. Anybody can refer, you know, into most of these nonprofits, but we've got to know what there is, and then we've got to identify what is lacking. So there's certain very vulnerable populations where I don't know what to recommend. I don't know where to take this person. And so uniquely, I've got this interesting line of sight, and you know, sometimes have the microphone to be able to amplify that for this person. I don't know who to help. But if you want me to come to anything, my team actually took my phone number off my business cards at a certain point, and I put it back on. I will come. I will show up.
Thank you. And the next question is, when we travel downtown, we see so much drug use while walking around. If arresting people isn't the answer, then what is? How are we making progress to help people improve their lives, not just save their lives when they overdose?
That's such a good question. So my basic philosophy is we should focus on intervention first and then deflection, which means outside of first response, right? Somebody is actively outreaching someone, building relationships, hopefully can inspire them into whatever services they need. And diversion, that's when you're bumping up against the criminal justice system. I describe CARE fundamentally as the diversion unit, right? Health One's a diversion unit too. We're saying, okay, we don't want to have to use the arm of the law. We want to get you help. But I am the first to say, it's because I know so many people in recovery. I do spend a lot of time in prisons, and when people successfully change, sometimes they had to be arrested, that behavior had to be paused. And so I'm always advocating that system needs to be humane and it needs to be helpful. But if we think about even the term arrest, it's to stop, right? We want to abate this behavior. And we don't want people to self-destruct and harm community. It's really hard to come out of that. You know, I lose sleep a lot of nights because most of my career was in child welfare. And it's so predictable how we end up where we end up sometimes. And I do believe that every life has equal value. I believe that in my cells. And we need to acknowledge that in our investments and how we treat people. And we've got to stop conflating punishment and accountability. We all need accountability. I studied the brain. It's impossible to change, right, if you don't have a consequence. But that is not the same thing as punishing someone and wanting them to sit in their shame, in their loss, in their grief, feeling like their life has no value. So, boy, I just went way. All right, a little TED Talk with you.
Thank you so much, and now you have heard from all three of your chiefs, and I want to give a moment to your legislative state representative.
Hey y'all, I'm Brianna, your state representative. Thank you for joining us here in the 534th. I'd like to remind everybody that we do always provide snacks. They're in the corner over there. They can't have you out of this hour without a nibble. I recently got appointed in January of this year, so I've been in the job for a whopping 8 months. I've got it handled. That is not true. But I am here today to let you know that there are two pieces of government that are successfully talking to each other, which is something that we are all appreciative of during these trying times. And that's me working with Chief Barden on House Bill 1816, which would make the care department permanent in the eyes of the state. Right now, we are operating on the good graces of an MOU that allows us to continue to do this alternative response. That goes away on the 31st of the year. I'm going to be doing my very best to continue to work with Representatives Scott and Macri and all of the chiefs of the city of Seattle to make the care department permanent. So that's it. Coming attractions from your legislative session. And now the part that matters is actually your opinions. So thanks so much for listening to all of us talk.
And Representative Thomas is, like I said, so gracious to bless us with her presence tonight. She is wearing her main hat as your representative, but is also here to talk to you all. And so you'll see her around. If you have questions, feel free to reach out. And now we are getting to the meat and potatoes of today's forum. We have several tables set up. All of the tables, as I mentioned, are based on the One Seattle Restoration Framework. And so you are going to be invited to go to sit at the table that you're most interested in. There are going to be 2 times for table discussion. First, you'll have 15 minutes at your first table. We'll tell you when time is up, and then you'll be able to move to a different table for your discussion. The different chiefs will be moving around, and so if you have questions for them, feel free to stop. Feel free to stop by and flag them down, and you can ask them your questions. But I'm going to list, the list is here on the screen, but I'm going to point them out for you out of these. The first is gun violence and reduction. Over there to my left, your right, is raise your hand, gun violence and reduction and prevention is up here. The one behind there is effective emergency response. Then in front here with a lot of the officers is the high impact crime reduction table. Behind them is the substance use disorder table. Then there is neighborhood park safety right here in the middle. Neighborhood traffic safety right over here. Neighborhood beautification behind traffic safety. Then we have youth and community investments right back there. And then small businesses. Perfect. And so one of the other things I want to mention is your Department of Neighborhoods liaisons are also here to field any questions you may have. You'll see them in their One Seattle t-shirts in the back to my right, your left. They will be floating around so that they can get your input and hear from you. They are your specific liaisons for this area, so please feel free to stop them and ask questions as well. So with that, we're going to give you a couple minutes to get to the first table you want to sit at. Thank you.